So asthma is very common. 10 to 15% of the population have it, and it has a very wide range. On one extreme, we still have 5,000 Americans dying of asthma every year, and on the other extreme, almost 30% of our Olympic team have asthma. So it doesn't have to be a big deal once you know it's there and have the plan in place for what to do to try to take care of it. So first, starting out, what is asthma? The airway, so the main breathing tube comes down in here to the chest, and then it splits off one to each lung, but then those tubes split, and they 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 split. And by the time you get out to the smallest tubes, even for small children, they have 7 million of them. Normally, they should be wide open and clear. But in asthma, when they get triggered, there are two main things that can happen. One is that there's muscles around the outside of those tubes that want to try to go into spasm. One of the medicines that we'll talk about later, albuterol, is a very potent medicine at trying to relax those muscles. The other part that happens is that the inside of those tubes become swollen and you get increased mucus. Albuterol, on the other hand, doesn't do anything for that part. The only thing that we know that will take that part down is one of the anti-inflammatory steroids. When we talk about asthma, all we're really talking about is that the air tubes down in the chest are a little more sensitive or a little more twitchy than somebody who doesn't have asthma. Many times physicians get trained to trust their stethoscopes and chest x-rays, though those are not very good tools, not very reliable at telling us how asthma is doing. A little bit of asthma may sound horrible or look bad on a chest x-ray, and a lot of asthma may sound completely normal or look normal on a chest x-ray, so don't trust those. In those tubes, if there's problems in these main tubes, it might make lots of noise, but a couple coughs could completely clear it out and you'd be fine again. On the other hand, you could have millions of these little tubes completely packed or inflamed, and you'd sound perfectly fine, because when we listen with a stethoscope, all we can hear is probably the first 400 or 500 of those 7 million airways. Similarly with a chest x-ray, asthma, pneumonia, bronchitis, bronchiolitis, croup, all look pretty much the same on chest x-ray. So while people often jump to pneumonia, asthma is somewhere between 200 and 2,000 times more common than a single case of pneumonia. Well, at some point someone drew the line and said, these people have asthma and these people don't. Well, that doesn't really make a lot of sense to me. If you are even close to the line and you've had a recent infection, it seems like your chances are is you'll move a little more sensitive, and so under certain circumstances those people might act more like they have asthma, whereas other people who have gone a long time without having any problems, the sensitivity of those tubes is going to be a lot less, and they may not show any problems.